Hi everyone, welcome to this lecture on postmodern approaches. So the very first idea to understand is that the major philosophical theory underlying, or philosophy rather, underlying postmodern approaches is social constructivism. And through this perspective, we're recognizing that there are inherently multiple perspectives uh, on any given situation or experience that we socially construct our perceptions of reality. And using this approach to therapy means that the client is the expert and guiding the session more than the therapist. So just in terms of the power differential, that's how social constructivists typically work. There's dialogue and a lot of attention to the way that dialogue is occurring. Questions are asked from a very strength-based perspective, unlike psychoanalytic theory where we're really looking at what's wrong with the client, what's the pathology here. Social constructivists and postmodern approaches say, what's right with the client? What can we build off of in terms of their strengths? And it's an opportunity to develop new meanings for the client. With something like narrative approach, you will work to co-create a new story for them. You'll look at the ways in which the dominant culture stories have influenced their identity and current struggle. And you'll have an opportunity to explore with the client, where they've been successful before in their life when they've been struggling. How have they made it past, past traumas or past struggles? And I think that really the key point here is that through a postmodern or social constructivist lens, reality is subjective, and thus we're going to, you could have a group of people experience all the same thing, and we recognize that every person could have a different experience of that lived experience. I know, lots of experiences there. But it's just to say that because there's multiple realities, we can't assume that the one that we have, in terms of the way that we're interpreting the client's experience, is the truth. We look at multiple truths and then look at the ways in which those truths can be used to create a collaborative relationship and lift the client up and build off their strengths. So as I've said, it's a very positive orientation. We're not looking at the past anymore. We're really focusing on the present and future. Therapy is really, we're going to look for what's working. Where have you been successful before, as I've said? And we do this by finding exceptions to their problem. So let me give an example. It's very common for, as a college counselor for, when I was working with kind of traditionally aged college students, they'd have to navigate, setting up appointments for the first time or how to deal with conflicts with people in authority. And we would look for other times in their life when they've been successful in those types of positions and roles and think about how they can use the skills that they were able to utilize in the past moment in the new moment. So it's not that you're never drawing from the past, it's just that the past is only used to support the future. And again, here's that, it's right in the language, right? So we're solution focused and not problem oriented. The client is the expert. We're looking for very small changes. You're assuming that the client may only come to counseling once. And so what can you do in one session? I always tell my supervisees, as long as the client has had a positive experience with therapy, if they don't come back again, that's okay. It's actually pretty normal for people to kind of dip in and out of therapy. But as long as we've given them a positive experience, they'll have that association for when they're ready to come back and do more in-depth work. And we really, we're not an expert role here, so we are affording the client the space to guide and lead with suggestions. And this is a very solution-based therapy question, a very typical question that one would ask using this approach, which is, what have you done since you made the appointment that has made a difference in your problem? It's interesting. I had a former student who openly shared with the class that she had a solution-focused therapist, and she wasn't sure why she was constantly always kind of asking her these interesting questions. And it's because there really are sort of specific questions that a solution-focused therapist will ask in order to get at the client's strengths and move the client forward. And not unlike CBT, solution-focused therapists will definitely ask clients to do some homework in between sessions. So the therapist is going to look for different points in the client's history when they've been able to get through struggles in their life and how they've been able to do that. And if there's nothing else that you remember about solution-focused based therapy, it's the miracle question. And I use it all the time in a lot of different forms. So the therapist asks, if a miracle happened and the problem you have was solved while you were asleep, what would be different in your life? And sometimes I adapt this to say, like, let's do this sort of 5, 10, 15 years down the road. And it can just be a way, it's really helpful when you're doing goal setting. So when you're first starting with a client, or really even if you've been with a client for a while and you're starting to feel like your goals aren't as clearly defined, and it's helpful for the process for that to occur, then miracle question it. I do it all the time. It's a really wonderful intervention. So solution-focused therapy is really, we've talked about how it's strength-based. It's very positive. So there's lots of compliments and cheerleading and, just really praising the client in multiple ways to build them up and to help build their self-efficacy. And there's going to be, so thinking about the exception questions, right? Then there's going to be sort of exception questions around coping. So, how have you managed to carry on? How have you managed to prevent things from becoming worse? And you can hear in the form of the questions just how positive the perspective is. Scaling is another wonderful solution-based therapy intervention. I often start a group therapy session off by asking everybody to tell me very briefly on a scale of 1 to 10, where are you today? And I've also adapted this into lots of creative forms using metaphors. So, what baked good are you? What weather system are you? What song are you? So there's different ways to scale. And if you have a lot of people in a group, it's a great way to do a check-in without having to spend a lot of time getting lost in detail. And again, a solution-based therapist is focused on the idea that the first session is the last session. And so you should begin planning for termination from the very beginning. And solution-focused therapy is great for groups because a lot of groups these days are brief in nature anyway, 4 to 5 weeks kind of a thing. So it's very positive, it's goal-oriented. The exception questions can help to build rapport between clients. And most importantly, I think this is probably the biggest, besides the miracle question, another big takeaway, which is that goals for therapy are very small, realistic, and achievable. So, I will often ask a depressed client, I just want you for in between this week and next week to walk around the block one time. Really breaking down the steps towards moving towards wellness, whatever that means to them, into really small and manageable steps. And then usually I will document it. So I'll write it down. We write it down together. And then that's a way for us to check in with each other if we are able to see each other again. Another postmodern approach is narrative therapy. And just like the name implies, it's all about storytelling. It is It's becoming more and more popular as an approach because it is and was developed in Australia for a cross-cultural population, and so it really does fit within a lot of different community settings. And you're going in, again, the client is the expert, you're listening with an open mind, you're not looking for pathology, you're listening to the stories that they're saying and where they're getting stuck. What is what they call the problem saturated story? And the number one sort of aspect, again, that I would say take away from narrative therapy is that the person is not the problem. The problem is the problem. So what does that mean? That phrase is kind of famous. So the problem is the problem. So when you're working with a client, you're going to externalize the problem. So you're not depressed. You have depression, and what would your depression tell you? So it's not a part of your identity anymore. It's a part of your story. And in this way, you can have a very collaborative approach. Storytelling, has been around since the beginning of time. And you have an opportunity to look at and hypothesize different ways that the story might end. You might not have control over, obviously, the beginning of that story, but how that ends. And you will also look at different ways that the dominant cultural narratives influence the presenting stuckness, if you will, of the client. And so there's lots of active facilitation with active listening skills. You're still very much focused on their positive strengths, their talents, their abilities, cheerleading, positive feedback, and just really being respectful and open to the experience. And so what is this idea about like a not knowing position? It's essentially saying like, you are not an expert in the client's story. The client is the expert. And so you are helping the client to form their story through asking different types of questions. And so we take a not knowing position, even when we think we may know, which I just, through my own clinical practice is often the case, right? We often have some type of conceptualization of the client's issue before perhaps they've gotten to that level of consciousness or that level of awareness. But still, we are not the expert in this model, so we're helping the client to develop their own story. And here's this main point here that I talked about before, the externalization. So separating the person from identifying with the problem. And then you get to look at ways of deconstructing their stories, co-creating stories, and the assumption through this lens is that we're constantly reauthoring our lives. And through, caring facilitation, we're able to do that in a productive way. And narrative approaches are used in lots of different settings really across the world. There's a Narrative Therapy Institute in Australia where narrative therapy comes from, but it is now used in most settings. If not in its full form, its the full theoretical form, many approaches now incorporate aspects of externalization or storytelling, deconstructing narratives. And again, as I mentioned, this was already developed in Australia for a cross-cultural population, and thus it draws from social constructivism, which often makes it a good alignment for licensed professional counselors because we use social constructivism as a theory in forming the way that we teach counselor educators, for counselor educators to teach counselors. So we already recognize that there are multiple realities always in an experience as counselors, but narrative therapy really highlights the social cultural context. So most importantly, again, just talking about through these postmodern approaches, the therapist is not the expert the client is, and at times you're going to have clients who really want you to be in expert mode, want you to take a power over position like a doctor or something like a medical model. And for those clients, postmodern approaches, if not explained really well in an informed consent, can be confusing. And it is very uplifting. This is a pathologicalizing stance. And both tend to be brief in nature. And, there's, yes, you could rely more on techniques, but again, I think that has to do with a counselor who just hasn't developed far enough in their own skill base in terms of their attending and listening skills to further develop rapport within the relationship. Because really reliance on techniques could be a limitation of any theory, but they've chosen to highlight it here, so I'm going to mention it. And so I encourage you to take a look at both approaches, particularly solution-focused therapy if you're interested in working in any type of academic setting. As a college counselor, we often had to use solution-based approaches because we might only have 4 to 6 sessions to see a client. And you want to be careful about, not opening somebody up so far that you can't close them up, so to speak, before your work with them ends. And narrative approaches allows us to be, allows us to empower our client to be in control of their story. And that's it for narrative approaches. Thanks for listening.